Good afternoon. We're Group 5, and we're here to talk to you about the QUERVAIN'S TENOSYNOVITIS. My name is Jaishan, and my job is to bring forward our group's goals, which is basically to provide a risk assessment that is quite brief but also detailed into DQT, which is a disease that is not commonly known within the community, but it does affect the general population quite often. So, what exactly is the QUERVAIN'S TENOSYNOVITIS? Basically, what happens is that the sheath and the tendons that surround your thumb and your wrists get inflamed, and this occurs due to the synovium, which gets irritated. And when this happens, it leads to a lot of friction and pain and chronic overuse of both the wrists and the thumbs, especially when gripping and pinching objects. It leads to a lot of discomfort and future complications that may also arise. Our objectives here as a group is to provide the general population with a variety of new treatment options to help them understand how to prevent and also treat the QUERVAIN'S tenosynovitis, and to spread awareness about how your environment affects the risks of you getting the QUERVAIN'S tenosynovitis. I'll pass the torch on to my group mate Inshana, who will talk about the current interventions.
My name is Insha, and I'll be talking about the current interventions. The current interventions that exist for QUERVAIN'S tenosynovitis is the corticosteroid injection. It is the main solution to DQT, and it's an injection that is commonly used to reduce inflammation. Corticosteroids are manufactured drugs that closely resemble cortisol, a hormone that adrenal glands produce. They temporarily reduce the body's immune system activity, which decreases the inflammation. The next intervention is the thumb spica splint. The thumb spica splint supports the joints that are painful or unstable by keeping the thumb immobilized while still allowing the fingers to move. They do this by using Velcro strapping. However, there are also some side effects of this, which include pressure soreness, damage to nerves and blood vessels, and decreased range of motion due to the immobilization. The last intervention is non-steroidal anti-inflammatory drugs. These drugs are also used to relieve pain and inflammation by preventing certain chemicals which cause inflammation. Most people who take these drugs find them to be pretty effective, but some people do need to be careful, such as those over the age of 65 and pregnant women and people with asthma, etc. So I'll be passing it over to my group mate, Jennifer, who will be talking about the stats.
Okay, hi, my name is Jennifer, and now that we have an overview on what DQT is and what are the current interventions, we can take a look at the stats right now. So DQT occurs mostly in women, with women being 4.6 times more likely to get it than men. And this occurs mostly during the pregnant or childbearing stages and menopause stages. And it's because of the fluid retention and changes in the hormones, and repetitive forceful hand movements due to carrying the baby using their thumb and their wrists. There is also a correlation between growing older and getting DQT, as people older than 40 are 3.3 times more likely to get DQT than people younger than 20 years old. So the elderly are at risk for DQT, and it's related to their age because of the changes in the structure of connective tissue. These changes actually may also be included and contribute to low energy level tendon rupture. Now, who usually gets it, and how does the work nature cause the WMSD? So analyzing the statistics that was conducted by the Defense Medical Epidemiology Database, mothers, daycare workers, professional tennis players, and gardeners are usually the ones who get this disease because of their hands being used repetitively for forceful movements, which affects their internal tendon sheath. So now I'll be passing it on to my group mate, Raid.
Hello, my name is Raid. Today I'll be talking about healthy adults versus people with DQT. Anatomically, the tendon sheath of a person with DQT will be thicker than someone without DQT. The tendons will also be inflamed, causing swelling for people with tenosynovitis. Physiologically, a person with DQT might have a faster heart rate due to the usage of the affected thumb, causing pain, causing increase of heart rate. There also will be inhibition of the use of the affected area due to DQT. Now I'll be talking about our proposed intervention. Our proposed intervention is the addition of an extra thumb as the cause of the WMSD is due to use of the thumb, overuse of the thumb. An extra thumb would give adequate time for the person affected with QUERVAIN'S to rest while not losing the function of the thumb. This is because the addition of a robotic thumb here would give more stability, which is clinically proven. It will also give the affected biological thumb rest. Now I'll be passing it on to Isma for conclusions.
Hi, I'm Isma, and I'm gonna present the conclusions for this presentation. The QUERVAIN'S tenosynovitis refers to the inflammation of the sheath around your tendons in the thumb and wrist, and it's usually experienced by individuals that do work involving repetitive grasping and overusing of the thumbs. This condition occurs more in women than in men. It occurs 4.6 times more in women than men, and 3.3 times more in people older than 40 compared to people below 20. And the usage of the affected area is usually inhibited due to this disease, and an increase in heart rate is also observed.
Thank you guys for joining us in this presentation. I would love that to know more about what you guys think in the comment section below. Thank you.